Good morning, good morning. I'm Dr. Dale Dangleben on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel. I would like to do my medical tidbit of the day. I'm going to talk about diabetic retinopathy. And again, it links back to blood sugar, right? Diabetic retinopathy. This is a serious and potentially blinding, literally, complication of diabetes, all right? It's chronological, meaning that with time, right, buildup of your sugar in the vessels, the tiny vessels. I talked about neuropathy yesterday. The same thing happens on the level of the eye at the retina, right? The light sensitive tissue in the back of the eye, right? And it is one of the leading causes of vision loss worldwide, all right? So early detection, tight glycemic control, and timely treatment is important, right? So like I stated, the root cause is prolonged elevated blood glucose levels, all right? And those high sugar level weakens and damages the small blood vessels in the retina, right? And that causes damage, right? And you have a lot going off, because you don't have the adequate blood flow. So you have literally swelling and leakage around these vessels in the retina, all right? So the duration of your diabetes going uncontrolled is an issue, right? So poor blood sugar control is key to making this worse. Your hemoglobin A1C, which I spoke about, needs to be managed, needs to be tightened, needs to be below 7, preferably below 6.5, and maintained there with frequent visits, all right? Pregnancy can make this worse, all right? If you already have underlying diabetic eye disease. Tobacco use affects everything, all right? Because tobacco use increases your vascular, which is your blood vessel complications in diabetes, all right? There are several phases to this retinopathy. You don't just wake up one day and say, oh, I'm blind from this. It's a buildup, right? And I won't get into all the stages, but there's early stage, middle stage, where you have small bulging of the vessels, which is called microaneurysm. You could have some retinal hemorrhage, bleeding from the retina, right? And then you have lipid, which is fat deposits, and then you get what's called the macular edema, which is swelling in the central part of the retina. All right. So when you have no blood flow to that area, then you start having definitely significant vision problem, right? And then you get into a more advanced phase, which a lot more going on with glaucoma, right? This is the vessels being blocking the fluid drainage that's supposed to manage the fluid in the chambers, of the eye. You can get what's called retinal detachment. This happens because when you have the blood vessels affected, you got scar tissue, and then scar tissue pulls, you have traction, from that, right? So again, these things are very, very important to note, right? So if you're diabetic and you start having blurry vision, or you're fluctuating vision, you have dark spots, which we call the floaters. You see that, right? Your color vision is starting to not be as good, right? And these are the things that you have to pay attention to, right? Because some of the symptoms can be silent, right? I wear readers because my eyesight has deteriorated, significantly. I just had my retinal imaging done last week. I'm waiting for the report on that. So there's several things that you can do. The fundoscopy exam with the light, the direct visualization in the back of the eye. There's something called fluorescent angiography, where you put a dye into the vessels and you take a look at it, right? And then there's a lot of things that you can do. There's the high definition cameras that literally takes this pictures of the back of your eye that shows the retina and the vessels. So the key is, in wrapping this up, is medical management of your diabetes. Keep your hemoglobin A1C below 6.5. Okay, your blood pressure control is important. Your lipid levels, if you have cholesterol issues, is important. And I will not stop emphasizing lifestyle changes, the diet, the exercise, and quitting smoking. Period. No matter what it is you're smoking, that's going to affect it. All right. There's a lot of other treatments out there that I would really leave that up to the ophthalmologist, the eye specialist, and things like that to really, talk about in terms of the medicines and the surgeries that can be done, etc. But prevention is the best. Okay, and if you're diabetic and you're a woman, and you're planning to be pregnant, have a good exam, prior to all that, or early in the pregnancy and things like that. So there's a lot of things that you can do to get yourself, ready and better. Because if left untreated for a long period of time, you will continue to go blind to the point of permanent blindness. All right? So this is all I have to say on diabetic retinopathy. It's a very preventable, all right, but potentially devastating complication of diabetes. All right, let's continue to educate each other. Make time for your endocrinologist, right? Go see your ophthalmologist. There are a couple good ones in Dominica. And again, we have to continue to educate each other. Have a great day. Peace.